Nose reshaping surgery, also known as rhinoplasty, is one of the most popular cosmetic surgical procedures performed around the world today.
The size, shape, and position of your nose has a huge impact on the overall harmony and balance of your face. Today we're going to talk about how to restore balance and harmony to the face through rhinoplasty. We're going to talk to Tina today and see her incredible results. Rhinoplasty is a procedure that really is targeted to create harmony and proportion in the nose. And there's three parts of the nose that we want to address: how far it comes out, the projection, the length, and the tip rotation. And it also is targeted to improving breathing and alignment.
And doctor, can fillers be appropriate for this area?
Fillers are a great way to test it out and see. If you have small irregularities in your nose, if you have a small bump, if you have a drooping tip, fillers, injectable fillers, can be used to create that balance and harmony in a temporary way. And you know, another important point is that we don't want to just create one nose for everybody. In order to keep people looking authentic, we want to design their nose around who they are and their shape. People coming in with a picture of a celebrity is a good place to start, but certainly we want to move beyond that and create natural looking noses that are perfectly proportioned.
So Tina, what was the decision that prompted you to move forward with rhinoplasty?
Basically, I found that as I got older, I had a bump in my nose, and I actually was quite comfortable with that. It was part of who I was. But as I was aging, my nose started to get a little bit crooked after the bump. And I started noticing in pictures it was a little bit noticeable, and it started to bother me.
Dr. Torgerson, can you walk us through the steps of Tina's procedure and what it was like?
Tina had a little bit of a crookedness to her nose, and particularly the tip, because the inside partition of her nose, called the nasal septum, was also crooked. She had a little bit of boxiness or heaviness to her tip, and she had a little bit of a small dorsal hump on the top. So we wanted to address all these areas and bring it back into harmony, into alignment. And I always say that a straight, well-balanced nose is also a nose that breathes really well and works well. So form and function need to go together.
And Tina, what should patients expect during recovery?
I had some swelling in my nose area, as to be expected, and there was some packing up there. But for me, I was quite comfortable, and I just decided to spend really one day in bed watching movies, and then the next day I was out going to a game.
How long is the recovery with rhinoplasty?
So Tina's experience was awesome for her, but I always like to be a little bit more conservative. Usually I tell people that they should take a break for 10 days to 2 weeks, where they'll feel congestion, some tenderness, and definitely some swelling and bruising. After the cast is taken off a week after the procedure, there's a quick improvement during that second week. And for most people going out after the cast is taken off, you'd find that people on the street wouldn't know that you had a procedure done. It does take a full year for the nose to completely heal after a rhinoplasty surgery, though.
So it's more like a marathon.
It's a little bit like hurry up and wait.